Hi guys, good evening and good morning if you're in Philippines and good evening if you're in United States of America. Once again, it's Thanks God It's Thursday for the Balance and Pulse Support Group. And if you are in United Arab of Emirates and Saudi Arabia, Salam alaikum guys and welcome to all my friends there. So tonight for our Balance and Pulse Support Group podcast, we have the Thanks God It's Thursday. Every Thursday, we featured innovator and physical therapists and entrepreneurs as well. We have many leaderships and academicians as well. So we would like to interview them. That way we have some motivation. What are their challenges in their career and how they've been motivated to be able to help others? And if they are entrepreneurs, how did they do that? If they are academician, how they transition to that. So tonight we have the opportunity to learn more with our guest. And we have Dr. Carmen Cooper-Oguz. She is a physical therapist for more than 25 years and also a leader. And as well, she has lots of acute care and practice, critical care in Mississippi. And she's based in Mississippi Delta. She is one of the 15 board of directors in the Academy of Physical Therapy Association, and she had her fellow. She is now a FACHE member, a fellow of the Academy of American College Health Executive. And she's also the vice chair of the DAI, or Diversity, Equity, and Inclusion, also in Mississippi. So that's really amazing. Lots of energy there, Carmen. So
yeah. Well, thank you.
We would like to welcome you, Carmen, right now, guys. So let's check it out. Carmen, welcome to our podcast.
Hey, thank you, Jenny. I'm happy to be here. I just have one point of clarification. I'm on the board of directors for the American Physical Therapy Association, not the Academy of Acute Care.
Yes. It should be the American Physical Therapy Association. And she is also working in an critical care hospitals, right? So tell us more. Tell us more, Carmen. So,
I will do that. I work in a critical access hospital, which there are about 1,300 or so critical access hospitals in the United States. And what's different about critical access hospitals is they only exist in rural areas and they have 25 beds or less. So they can have up to 25 beds, which can go either way as acute care or subacute care. So not every rural hospital is a critical access hospital, but every critical access hospital is rural. And the way that insurance is billed and things like that is completely different from a PPS facility. So anything that you know about a regular PPS hospital or a big healthcare system, just throw that out of the door and flip it up on his ear and you've got a critical access hospital. So
wow, that's really something to learn for. We are really very wide. As a physical therapist, I'm working in home health. And I have acute care as well prior. And then right now, when I was in Saudi Arabia, I work in rehab, outpatient, and now we are more in geriatrics. So that's a lot of field to learn more as a physical therapist. And I applaud you for being like wearing all the academy physical therapy shoes, PT.
Yeah. Well, thank you.
Why do you think it's very important to promote, explain to other people, to help the organization, to advocate for the academy or to any organization that you're really helping and representing?
No, that's a great question, Jenny, because if we don't get the word out to the people about what physical therapists do, because we're very, very multifaceted, who will? Because over the past, several decades, some therapists would say and would make note of the fact that there's been a bit of an identity crisis because physical therapists and physical therapist assistants can do so many things, chest PT, aquatic therapy. Some might even do hippotherapy, to name a few things. But thanks to the American Physical Therapy Association and a lot of streamlined branding efforts and logos and advertising, we are helping get the word out to the people that, you don't necessarily have to see a doctor in certain states for certain issues. You need to know that you can come directly to a physical therapist, because many, if not all, the states have some degree of direct access, but there are many states in the United States that do have direct access, full direct access, and then it trickles down from there. But unfortunately, Mississippi is one of the states that has the least amount of direct access, and we're working within our state organization to advocate and lobby to our legislators to change that. So it's very important to let people know who you are and what we do.
I like that. Yeah. Even the color is so vibrant.
Yeah.
The PTA, the hood. So how can they get that? Is it in the store? You said it's in the store.
Absolutely. So the American Physical Therapy Association has a website, and it's got a page on the website that's dedicated to APTA gear. And this is our 100th year of the American Physical Therapy Association. So it's got general gear, but it's also got koozies and cups and t-shirts directly related to the celebration of our 100th year. So go to apta.org and go to the Centennial store, to the APTA store. So that's apta.org, and get your gear.
Yes. I got the tumbler and I like the journal.
That's right.
I love the color, the turquoise that they chose. I like that.
Yeah. So teal is the national color of the American Physical Therapy Association. So I've got a lot of did you knows. So anyway, fun fact.
I love that color. I'm so happy that they chose that. Even they chose the orange. I like that too.
Yeah.
You say something about the partnership. Tell me, and congratulations to become a fellow of the FACHE. And tell us more about the FACHE. I always see this. I would like our listeners to know, what is the being a fellow of the American College Health Executives and how to be part of it?
Oh, I would be happy to share it. And I was even more surprised. It was such a pleasant coincidence. About a month ago, I, as an American Physical Therapy Association member, received an email saying that the American Physical Therapy Association is partnering with the American College of Healthcare Executives, and APTA members can get half off their membership of the American College of Healthcare Executives organization. And the reason this is so important is because we know that physical therapists and physical therapist assistants are wonderful clinicians. They take care of themselves. They deliver great therapy services. However, we've got some fantastic leaders, healthcare organization leaders, who may or may not have some untapped potential as hospital executives. So, many hospital executives and healthcare organization executives, they've never done clinical work a day in their lives. So you don't necessarily have to be a licensed professional to be a healthcare executive. But I do think licensed professionals bring a lot to the table in terms of learning how to manage people and manage an organization that helps patients, right? So I became a member of the American College of Healthcare Executives because I knew that one day perhaps I wanted to be the CEO or the COO of a hospital or even of a bigger healthcare organization. And I'm going to get there one day. But I knew that my first step was to become a member as a physical therapist. I didn't have to be a physical therapist, but I did have to have a master's degree. I did have to have a lot of years of organizational service and of professional service. And you give examples. And then I was able to sit for the exam where members of the American College of Healthcare Executives can become fellows. And the acronym is FACHE. FACHE. You put that behind your name, and nearly every healthcare executive of some really, really notable organizations across the United States have these credentials behind their name. Because when you take the exam and you become a fellow, you're not only showing that you know how to treat patients as a clinician, because you don't have to be a clinician, but you know how to manage your department. You know how to manage people from a human resources perspective. You know how to manage your money and your finances from a budgetary perspective. So this 6-hour exam to become a fellow, oh, it really, really stretches your mind and stretches your limits. And it asks questions about a PPS hospital, and it asks questions about a critical access hospital. So you have to know about it all. It even asks questions about unions, employment unions. And in Mississippi, I dare say we don't have very many, and I certainly don't have any experience with them, but I had to learn. So it's a very, very unique and important opportunity for the APTA to partner up with the ACHE to integrate leadership skills from the physical therapy profession, to healthcare leadership.
Yeah, it's really good that they're able to partner with them, because first of all is majority of our members who are really wanted to serve and become a leader has
That's
the
right.
opportunity to be more on that level, right? And they're
Right.
really deserving. I agree when you said that as a therapist, we are healthcare providers. You know what to be part of the hospital. What's the problem behind staffing wise, right? So now
Right.
you became from that level, you're an employee. So now when you're on the leader or the executives, when I was an employee, I want to have more staffing. Oh, this is our issues before. There is
Right.
no incentives with all the staff members. Oh, there's lack of motivation. So you know the issues before when you're on the level of being employee. Now you will be the leader. You know how to be like that. So that's really good, right?
Exactly.
Yeah.
Exactly.
And then also, thank you so much for explaining those to us. When you say organization, experience professionally and also in community, which organizations are they covering? Like included? Is it anywhere? Like which organization you can say in particular?
You're talking about with the Academy of the American College of Healthcare Professionals?
Yes, when they said requirements. Mm-hmm.
Oh, okay. So they want you to demonstrate and to explain at least 2 examples of leadership within your community. So they want you to have that hospital or that healthcare organization mindset, because you also have to provide 2 examples of what you've done professionally, but they also are looking for hearts of servant leaders who give back to the community. So that was really easy for me because I'm a Rotarian. I'm a member of Rotary International, which has Rotary clubs all over the world. So I just recently served in a really, really big district role, but I didn't get to that district role until I had a more local club role. So I didn't have any problem explaining my community service there, but I think most of us learn community service during physical therapy school, because most physical therapy programs and physical therapist assistant programs, they promote the attitude of service. So if you didn't know service before you enrolled in PT or PTA school, you certainly learned about it in your degree program. And I think that's important. And that really, really makes us special as clinicians, because we learn to have the hearts of servant leadership.
Yes. I like when you say the heart of being a servant. We are servant leader for our patients. We are patient advocate. So tell us more about your challenges. Speaking as a clinician, you have more than 25 years of experience as a physical therapist. What's your most very that you always remember. You
Yeah,
are always happy as a physical therapist because you did this to one of your clients. So
yeah.
what do you remember?
Well, working and living in rural Mississippi, I am at the heart of access to care issues, barriers to getting people to get to the hospital or to get to physical therapy services. So, I've been in the thick of it even prior to the pandemic. So, in about 2016 and 2017, I really started to take notice of the disparities in care, maybe even before that. But in 2016 and 17, I took it to another level in terms of advocacy. I started advocating for teletherapy before teletherapy was cool. And I had never done teletherapy before, but I said, there's got to be a better way. If I've got poor people in Mississippi who can't afford to drive, they don't have a car, and Mississippi does not have a public transportation system, how can we keep people in Mississippi healthy? So I said, there's got to be a better way. And so I joined several sections of the American Physical Therapy Association, and there were several people that I met, and I was sitting at one of these APTA committee meetings, and I raised a few questions, and then it hit me like a ton of bricks. I said, instead of waiting for CMS or Medicare in the United States, of course, to change their policies at the top and then trickle down, because most of the insurance companies and state Medicaid agencies do fashion their payment structure or programs after CMS. I said, I'm going to change things in Mississippi from the bottom up. I'm going to work with Mississippi Medicaid. I'm going to work with the local insurance companies in Mississippi, Blue Cross Blue Shield of Mississippi, to name a few. And I'm going to get them to implement teletherapy services to allow them to be reimbursable. And then we're going to push that back up to Medicare, and then, make the change from a grassroots level and go up instead of waiting for somebody else to do it. And then, the pandemic caused a lot of heartaches, but it also caused us to open our eyes to a lot of things that we could do better, things that we could do different. And the pandemic opened up the channel of communication for telehealth. And I thought, my goodness, it took a pandemic to realize that there was a better way to provide therapy service and general healthcare services to these patients. All these years, we've been struggling with wondering why these people in Mississippi and in nearly every state of the United States, why are they so sick? It's because they don't have access to good health care. And then the pandemic opened our eyes to telehealth, which is not a complete solution, but it beats the heck out of what we did have. So one of my greatest rewards was being an advocate for breaking down barriers of healthcare, particularly via telehealth services, before it was cool. I didn't need anybody to tell me it's cool. I just needed people to realize that it works, and it was getting people the help that they needed.
They are really helpful. I have many clients here. I'm in Delaware right now, and we are also doing the telehealth. We are so blessed that they're able to cover it, Medicare. And thank you for your passion. You're very motivated. I see the big leader here and political blood on you,
Yeah.
you really fight and go.
That's right.
So
My
you
middle
are
name.
really representing everyone, and
Right.
you're really, I remember when you say that you're always thinking outside the box, and as a physical therapist, that's our talent. That should be our number one skill, and we always learning. We are like so thirsty to learn different knowledge, because I keep telling them these courses, this education gives us to become better person each day. So
That's true.
tell us more everything, like regarding courses. What do you want to share with us that helps you a lot, or specific books or educational courses that you can share that helps you to become efficient clinician to our clinicians that are listening, Carmen?
Thank you for that question. I believe that I have learned time management over the years because even when I was in college getting my first bachelor's degree, I've got 2 bachelor's degrees, a master's degree, and a doctoral degree. You know, you do learn to be very efficient and very effective with your time. But nobody ever taught me back when I was getting my bachelor's degree in business administration that I needed to develop goals. So I think that fundamentally, before you can develop a plan for your education or for your professional goals or for even your personal financial goals, you have to understand that you have to set these goals and set measurable objectives, much in the same way you would write your physical therapy or your physical therapist assistant notes, because you know, you have to have broad categories and you have to have short-term and long-term goals, because those long-term goals look like a big elephant and you're like, oh my goodness, I'll never get all the way over there. But it's your short-term goals, just taking one bite of that elephant at a time, that really get you there. And it was very, very apparent to me that these goal and objective developments, it was very important when I was developing 2 physical therapist assistant programs. So I've worked with 2 colleges here in Mississippi to from the ground up, from scratch. And, you know, boy, oh boy, that was a challenge, because I had to get this physical therapist assistant program ready for accreditation for this school and ready for accreditation for that school. And that was another worthwhile endeavor. It was doing it both times. I thought it was going to be easier the second time, but it wasn't. It was very difficult and challenging, yet it's very rewarding, because you're setting up a program that not only will affect somebody the rest of their lives, but you're shaping the person and the professional and the clinician that they're being. So, you know, I think any course that helps you clinically is great, but please don't forget that you owe it to yourself to develop your skills as a leader, because it's okay if you want to be a clinician the rest of your life. You're a fantastic clinician now. You're going to be an even better clinician 5, 10, 20 years from now. However, you most likely have untapped leadership skills and potential that can be unleashed if you just get connected with the right mentor and the right sources. And of course, working within the American Physical Therapy Association on a chapter or a section level, that's one very good way to get started. And then ultimately one day you may want to go into national leadership. And maybe with Jenny's help, you could run a national legislative campaign, and you could be your state senator or your national senator. So I don't know.
They can do that, right?
Yeah, you gotta think big, think outside of the box. Only you determine how high you will climb your ladder. You build your own ladder, you climb your own ladder, and don't ever let anybody tell you to stop climbing your ladder, because you're in charge.
Oh, I love that. Yeah, this is my ladder. Get your own.
That's right. That's right. You go build your own ladder, because I'm too busy climbing mine. Yeah,
exactly. And some people are going to pull you down on your ladder.
They're down there because they can't build their own. They don't want to build it. They don't want to climb it. You bring up a good point. There are always going to be people tugging on your ankle to slow you down or to even pull you down so you'll fall off. I don't care how old you get. You know, you see that in high school. You might see it in college. You're going to encounter it in your professional practices in your world. But, you know, you got to be the bigger person and consider the source and realize that they don't have enough to do to keep them busy. You just focus on what you need to do to keep climbing that ladder.
Yes, I really like that. You make a very good point, and also motivation for them. They're
Yeah,
listening right now. I like
good.
when you say, "Do you think that you will be a clinician just like that forever?" If it's okay because you love to serve, right? But you
Right.
can serve more if you have the leadership as well, that you can serve wider, and
That's
you
right.
have a knowledge enough to talk to this administration to be a representative and an advocate of the people you want to serve. Yeah,
Exactly.
and you are, like I always say, that you are the five, you are the person who are like the five people around you, something like that. I forgot. So it is, you really need to have a better people around you, because that's who you are. So
That's
different good mentors are very important, and check out the different resources that they're giving to you. Motivation, because they came from the bottom and they pass on these kinds of challenges, and they're giving you good tips. Don't do that because I've been there, that those are the mentors.
Yeah, learn from my mistakes. That's right. And no matter where you are in life, in your personal life, in your professional life, in your financial life, there are always going to be people who have done a little bit more than you. But then there are always going to be a lot of people who haven't done as much as you. So you've got a lot to offer as well as a lot to learn. So, if you develop the attitude of never stop learning or never stop climbing, your potential is infinite.
All right, that's really good point there, guys. So that's really from Carmen, and she already been in different field as a leader, clinicians. She's a wonderful leader in her place, especially in Mississippi as the vice chair of the DEI. And this is another big thing to think about: diversity, equity, and also inclusion. These are very important. So how about the balance, knowing that we as the physical therapist, what is your favorite like exercise as a clinician that you always use and do
Oh,
and
okay.
advise?
So as a clinician, I have developed a team that does most of the day-to-day work with the patients that are admitted to our hospital. But my current specialty is wound management and wound prevention. So I've also done some medical expert work as a legal consultant for physical therapy and for wound management and prevention. So, I really love to share my passion. When I get a consultation order for a wound that's been difficult to manage in the hospital, I always have a lot of nurses that come around, because every now and then you get nurses who are very interested in wound management. And you know what I do? I adopt the role and the heart of a teacher. And it doesn't matter that they're nurses or that I'm a physical therapist. We're all in there to learn. They listen to me and I teach. And who wins? Who wins? It's the patient that wins. It's the nurses who fuel their fire to go and learn more about wound management and prevention. I win because, it just makes me feel good to share something so positive and so helpful with people. So wound
That's really
management's kind
good.
of my thing. Yeah.
Okay. Yeah, I was a wound care specialist back in Philippines. It's not
Ah,
as yeah, it is
I
like
knew I liked you. I knew I liked you.
it is like I'm not a physical therapist. I think I'm a physical therapist already that time, but it's a product specialist.
Oh,
There's a product, the colostomy bags and the
right.
coloplast, and then I introduce to them. I see the patient to their house, teach them how to use those hydrocolloid dressing. This
Right.
is the better way, and this is the better way. I didn't know in America that there is a specialty only for that. That's another level. And
Yeah.
I'm
You're
just
an
selling those
ostomy
dressings.
expert. Yeah. And you didn't even know it. You're an
Yeah, I
ostomy
didn't
expert.
know.
How about
Yeah.
that?
Yeah, because in Philippines, we are physical therapists, and then I applied as a product specialist, and that's your title. And I
Nice.
really enjoyed because I see people, it improves the wound, teach them how to take care of their wound, their bag and everything. So that's really, really a personalized experience,
It
right?
is. It is.
Yes. So you're so busy. You're so busy, Carmen. I don't know how you're able to manage leadership, your office, your career, your family. What keeps you moving? I always ask that.
Okay, so I have to tell you that there have been times where I felt overwhelmed. I'm no different from anybody else out there. And I'm looking at you and I'm telling you that there are going to be some hard times when you start to say yes to opportunities more than you say no. There are going to be times that you feel overwhelmed and overextended. But what I've had, which I hope the same for you, I've had a wonderful support system from coworkers, from employers, and certainly from my family. I'll go ahead and share a little bit of personal information with you.
Mhm.
I'm married. I've been married for 20 years, and my husband and I have two sons. And he knew what he was getting into when we got married because I was passionate back then. I had already been a physical therapist for about 5 years. When we met, before I even knew him, I knew that I wanted to develop my career and work on me and be happy with me before I can make anybody else happy. So that did fall into place. He knew I was driven and motivated when he married me. He knew that I was going to be the mother, the wife, and the professional that I always wanted to be. But I'm going to tell you one more funny story. My husband and I have a tandem bicycle. It is a bicycle that is yellow, that is built for two people. And we joke with one another because, sometimes people do need clinical help or therapy to talk things through to get you through the tough times. And I think that's very, very admirable that people reach out for help. But he and I use this two-seater bicycle as therapy because when we don't have time to go out to dinner or we barely have time to brush our teeth, we'll jump on that bicycle, we'll take a ride around the neighborhood, and all you can do is talk. You can talk and you can pedal. And sometimes when you get tired of pedaling, you don't talk, but you're together, and that's okay. That is okay. It's okay to need some downtime. It's okay to talk. It's okay to not talk. And it's certainly normal and natural to feel stressed out. So please don't believe that there's any superhuman out there that doesn't have these same emotions or same feelings or same needs.
Yes.
So I just wanted to share that. Nobody's perfect. And you just learn to cope and lean on your good support system. Develop it first and then lean on it.
Exactly. A support system is very important. It absorbs all your pressure, your stress, and gives you the motivation to continue on what you're really looking
Yes,
for. They support you on your goals as long they see you, your passion there. So
that's
that's
right.
really amazing. I'm very grateful, Carmen, to know you more and also to share all these wonderful stories, your knowledge, your expertise to our clinicians and to all the caregivers that were listening, because these clinicians are, some of them are new, and this is can be watched as well in Philippines. And
Good.
we have lots of passionate physical therapists looking forward to grow more in their career. And it's difficult in Philippines right now. They don't have the direct access yet, as what you're saying, and here in Delaware we have direct access to here. So it's really we're so lucky enough that we're able to help and advocate our patient and also our colleagues, and we have this kind of organization that advocating us to be able to be on that level in behalf of those billing, those reimbursements, and all those other challenges. So how can we connect with you, Carmen? If there are some clinicians there who wanted to know you more and be your mentor, be a mentor, something like that. So tell us more.
Yeah, no, that's great because I'm on social media. I'm on Twitter, but Twitter doesn't give me enough. I can't express myself within the number of words that Twitter allows. It's too limiting. I love Facebook. You reach out to me on Facebook, ask me to be your friend, send me a friend request, and I will accept it, provided it looks legitimate. So don't try to ghost me, but I will become your friend. Of course, with Facebook becomes a messenger attachment
Yes,
to which through which you can send messages. And I do mean it when I say I would really love to meet you all. I'm going to meet you one day, Jeannie. I'm going to meet you. That's not a threat. That's a promise. And just reach out, because we're all in this together. We are all in this together, in this world, this human race, the healthcare profession. Let's lean on one another. Let's develop our networks and our support system. So Facebook.
Wonderful. That's wonderful. Yes, we have Facebook already.
Good.
Everybody has Facebook. They have also Instagram. So everybody can connect with each other. So guys, so that's Carmen Cooper-Oguz, and she has the Facebook. She is part of our balance and pulse support group. If you don't have an access with her, let me know, and you want to connect with her, I'll let her know through email and messenger as well. So thank you so much, Carmen. Thank you guys for listening. It's a wonderful night again for the Thanks God It's Thursday. And I really appreciate everybody who always asks us some great questions and things that you want to learn more in our Balance and Fall support group. So it's me again, Dr. Jenny, Yusuf Physical Therapist and Doctor of Physical Therapy, clinical founder of Balance and Fall support group and Fissiogen PT and Wellness. I'm the vice chair of the Global Health in Aging Adults, a special interest group by the American Physical Therapy Association. So if you have any question, guys, connect with us, and thank you so much. And God bless. Thanks, Carmen.
Thank you. Good night, everybody. Thanks, Jenny.
Good night, guys.